The school health program began in 1995 as a partnership with Spectrum Health in Grand Rapids Public Schools. And in our program, we provide nursing services to children while they attend school. If they get injured at school or they get ill at school, that they are taken care of safely. And those are the services that are typically provided by our community health worker or our school health aide. In addition to that, though, the districts that our program focuses our attention to are those districts that have kids that need access to care. And we do know that that is a significant challenge to some of our children and their families. And mainly it's because either they don't know when they should go and they go too often, or they don't know when they should go and they don't go and the child suffers consequences.
If you don't have a healthy child, you can't teach. And I just recently came back from a superintendent's conference, and this is so unique. I was with 65 other superintendents around the country, and this is such a unique partnership that I can't imagine people not doing it. I think it's low-hanging fruit to be in a relationship with your hospital and to allow people to come in to help. They have the knowledge and the expertise, and we need to teach. So it's just a perfect marriage to me. And so I hope to see this in other communities.
We do know that about 15 to 20% of children that come to school have some chronic disease. And we then work with the parent and the child's physician to make sure that we're ready for emergencies with their specific medicines and what care that they need at school so that they don't feel afraid to come or their parents aren't afraid to leave them. And so we develop those emergency action plans for kids with asthma and diabetes and seizure disorders and life-threatening allergies and hemophilia and sickle cell and, many other health conditions that are more rare than in the pediatric population.
I've been most impressed with the gentle nature of our school nurses and the relationships they've built with our students. That instead of telling our students, they're probably asking questions. And that strong relationship allows those students to come back and not be afraid, but rather to look at this, this is a healthcare professional who's a valuable resource for me. And as a school district, you couldn't ask for more than that.
It's really been my privilege to go into the schools for the past 20 years and to see the contrast. I know what it was like before. And now when I go into those schools and there's a room that's built and ready for them to receive services, there is a nurse and a health aide there that have the skills that they need to take care of them. And not only that, but I can tell when I walk into those places that the children feel safe and comfortable in coming there for their care, and that those nurses really genuinely care for them and are making a difference in their lives. And that is important work, really, to me.